Hi, Erica. Thank you so much for joining me on Two Things. How are you doing?
Good to see you. Thanks for having me.
Well, so many things have been changing, and this is a time for us to sort of catch up with you and hear your thoughts about some of those changes. So until this week, we've been taking care of patients with COVID positive and or COVID presumed with contact and droplet and eye precautions. Things changed this week, and can you tell me about what went into that decision for this change?
Yep, absolutely. Well, I think change is what we're used to, and change happens very quickly. So as we know throughout the whole COVID experience, if we want to call it, that there's been a lot of uncertainty. And part of that uncertainty has been about our PPE supply. And in all of our PPE supply, there's one piece of that PPE that has been very difficult to secure and secure in sufficient quantities. And that's been the N95 respirator. So in the setting of not being, having severe constraints about our N95 supply, what the CDC has instructed us, in addition to the Mass Department of Public Health, that in this setting, that you need to reserve your N95s to use in high-risk procedures, that would be aerosol generating procedures in patients who you suspect or have confirmed COVID. And then for the other care of these patients, that a surgical mask would be acceptable. And essentially what most U.S. hospitals have been doing has been that, really reserving that precious supply of N95s for situations in which aerosols could be generated. Those potentially would be the highest risk procedures. And that's what we've done. And in addition to making that our partners-wide policy, we also did a lot of work, and thank you to everyone who's been doing extended use and reuse, that allowed us to conserve our supply and work, a lot of people working behind the scenes to both get new supply and bring on a new technology that will help us extend our supply through decontamination. And so those kind of two features have come together, and in the last week or so, with a lot of great work on modeling, looking at when the surge is going to happen, what we can expect in terms of our patient volume and our utilization, we were able to determine that as an entity, we had a sufficient supply that we could then go to the CDC's guidance that says, when the supply is restored, you then replace the surgical mask with an N95 or a PAPR.
That's awesome. So that's really great to understand exactly how we came to this change. Has anything else changed?
So many people will ask, have we decided that transmission is different, right? The purpose of using the surgical mask is because we have believed, and we still continue to believe, that the vast majority of transmission of this virus is through large respiratory droplets. Those large respiratory droplets can fall on surfaces that you then contact and then self-contaminate by touching your eyes, nose, or mouth. That has not changed. There have been gazillions of publications coming out, but none of these have really fundamentally in any way changed that belief and that premise that SARS is spread through droplets. At the same time, we know that in certain situations, like an aerosol generating procedure, which is why we preserve the N95s for that there can be aerosols that form and small enough that would be the potential for an airborne transmission. So none of the changes really result from a change in what we think is happening and what we have our understanding of it, but it's more about our ability to have confidence in our supply that allows us to shift gears and use the N95s instead of the surgical mask.
Wow, that's really great to hear. So, and I know that things change, but some things have not changed. But our fundamental understanding of that part is good to know, and that we are adjusting based off of our supply and what we think we can do. So that's wonderful to hear.
Yeah. I think one of the other parts, and that I'm hoping that everyone, this is probably obvious to everyone, but just it's worth repeating, is that we were really focused a lot on the N95s, right? They were really hard to get a hold of. There's a lot of interest in getting the N95s, but that's just one piece of your personal protective equipment. And, there's Your other pieces of personal protective equipment are incredibly important, but outside of the actual personal protective equipment, it's how you use it. You know, are you doffing correctly? Are you doing the hand hygiene? And even beyond personal protective equipment, we are doing a lot of other things that are helping prevent transmission. We're doing social distancing. We're social distancing right now. Right now, in real time, we're social distancing, which is good. We're doing universal masking when we're on the hospital premises and we can't, you know, you see everyone in the hospital going around with their universal masks. We're doing a lot of other things that combined with our personal protective equipment, you know, is the sum. And so that I really want to emphasize, because while you could have all the N95s that you wanted in the world, but if you don't doff them correctly, if you don't do the hand hygiene, if you don't do all the other things, you really haven't gained anything. So I would see this as an added measure. It is a terrific feat that the supply chain folks have been able to do this. It's a terrific feat that all of us have done extended use and reused and prioritized the N95s for those riskiest procedures. But it's part of a bigger picture, and we all have to keep our eye on the ball here, which is we're in this together. We don't really know what lies ahead, but if we focus on those principles, I think we're going to do really well. And clearly, we're doing an amazing job with all the changes that have occurred in the span of days and weeks.
Agreed. Thank you so much, Erica, for sharing your thoughts with us today, and all the work that you, the emergency preparedness team, everybody at the hospital is doing to keep our staff and our patients safe.
Thank you. Thank you, everyone who's watching this. Thank you, Nancy, for everything you're doing. I really appreciate it. I hope to see you in person at some point soon.